You're sitting down and you stand up to get some coffee, and suddenly your heart is pounding, racing, fluttering, maybe even skipping a beat. You freeze. You think, is this my heart? Am I okay? If you've ever felt that, you're not alone. Most people who feel it have no idea why it's happening or whether they should be worried. Today I'm going to walk you through the real medical reasons your heart does that, from the most common everyday causes to the most serious reasons. And stay with me until the end, because I'm going to tell you about a patient I saw recently, a 36-year-old woman whose story I think a lot of you are going to recognize. I'm Dr. Barron, a board-certified rheumatologist, and while palpitations might sound like a purely heart issue, the truth is they come from so many different directions. Your lifestyle, your hormones, your nervous system, even your medications. They're often a piece of a bigger picture, and anyone can experience them, so let's get into it. First, let's understand what a palpitation actually is. Your heart beats because of precisely timed electrical signals that tell the heart muscle when to contract. Under normal circumstances, you don't feel that. It just happens. A palpitation is when you become aware of your heartbeat, either because it's beating too fast, too hard, too irregularly, or in a way that feels off. Something is disrupting the normal rhythm or making you more sensitive to it. And there are many different things that can do that. One of the most common triggers is something most of us consume every single day. Caffeine. Coffee, tea, energy drinks, certain sodas, all of them can stimulate the heart and make it beat faster or more forcefully. This is especially true if you're sensitive to it or if you had more than usual. Nicotine does the same thing. And here's one thing people don't always expect. Some over-the-counter cold medicines. Decongestions like pseudoephedrine, which is common in a lot of cold medications and sinus products, can push your heart rate up. So if you're having heart palpitations and you've recently started a cold medication, that could be the connection. Alcohol is another one to keep in mind. Some people notice palpitations after drinking, especially in larger amounts. There's actually a term for this, holiday heart syndrome. It tends to happen after heavier drinking episodes and can trigger irregular heartbeats, even in people who otherwise have healthy hearts. Now let's talk about stress, because this is a big one. When you're anxious or under pressure, your body releases adrenaline, and adrenaline is specifically designed to speed your heart up. That's what it does. That racing, pounding feeling you get during a stressful moment. That's not your imagination. That's a physiological response. In fact, anxiety-related palpitations are one of the most common reasons people experience them. And the tricky thing is, once you notice your heart is pounding, it makes you more anxious, which makes the pounding worse. It becomes a cycle. Sometimes palpitations aren't coming from what you're doing. They're coming from what's going on inside. Dehydration is a classic example. When you're low on fluids, your blood volume drops, and your heart has to work harder to do the same job. That extra effort can show up as palpitation. Low blood sugar is another one. When your glucose drops too low, your body releases adrenaline as an emergency response, and that adrenaline triggers the same racing sensation. Hormonal changes are also a major factor, especially for women. During pregnancy and menopause, shifting hormone levels can make the heart more reactive. Many patients going through perimenopause mention palpitations as one of the first things they notice. And then there's the thyroid. An overactive thyroid, what we call hyperthyroidism, can significantly speed up the heart. It's one of the things a doctor will check when you come in with persistent palpitations, because it's a hormonal condition that's very treatable once identified. Fever and infections can also raise the heart rate, because the body speeds everything up to fight what's attacking it. Now let's talk about what many people are most worried about when they feel palpitations, actual heart rhythm issues. The medical term is arrhythmia, which just means an abnormal heart rhythm. Some of these are completely benign. Premature atrial contractions and premature ventricular contractions, which are basically earlier extra beats, are extremely common. Most people have them occasionally without even realizing it. When you do feel them, they often show up as that skip beat or a brief thud in your chest. Others are more sustained. Supraventricular tachycardia, or SVT, is when the heart suddenly shifts into a rapid rhythm, sometimes reaching 150 to 200 beats per minute. It can come on suddenly and stop just as suddenly. It can be very alarming when it happens, but it's often manageable once diagnosed. Atrial fibrillation is another type, and it becomes more common as people get older. In this condition, the upper chambers of the heart beat chaotically and irregularly irregularly. People often describe it as a quivering or fluttering feeling, like a fish flopping around in their chest. This definitely needs medical attention because it carries additional risks over time. More serious arrhythmias exist as well, but they're much less common and usually happen in people who already have underlying heart disease. In some cases, palpitations are related to the actual structure of the heart, things like valve problems or changes in the heart muscle itself. These conditions can alter how blood flows through the heart or how electrical signals travel. But I want to be clear, most people who have palpitations do not have a structural heart problem. Still, palpitations are something that should be properly evaluated, particularly by a cardiologist. Other medical causes worth knowing about. Anemia, which is a low red blood cell count, makes the heart work harder to get enough oxygen around the body, which causes it to beat faster. And electrolyte balances, like low potassium or low magnesium, can actually disrupt the heart's electrical system. This is one of the reasons doctors check electrolytes when evaluating palpitations. Now let's come back to the patient I mentioned at the beginning. She was 36 years old. She came to see me for joint and muscle pain, but during the visit she mentioned something else. For months, almost every day, when she got out of bed or stood up from a chair, her heart would start pounding, beating out of her chest, she said, along with lightheadedness, sometimes shortness of breath. She'd have to sit back down and wait a few minutes for it to pass. In my office, I performed something called an active stand test. She lay down for 10 minutes while we tracked her heart rate and blood pressure, and then we measured again as she stood up for 10 minutes. Her heart rate jumped by more than 30 beats per minute when standing, with no drop in blood pressure, and she had the exact same symptoms she described at home. I referred her to a cardiologist who ruled out other causes and confirmed the diagnosis: POTS. Postural orthostatic tachycardia syndrome. POTS is a disorder of the autonomic nervous system, the part of the nervous system that controls autonomic body functions like heart rate and blood pressure. When you go from lying to standing, your body is supposed to automatically adjust to keep circulation stable. In POTS, that adjustment doesn't happen properly. Instead, blood pools in the legs and the abdomen. Less blood returns to the heart, and the heart compensates by speeding up dramatically, sometimes surging by 30, 40, even 50 beats per minute. That surge is what patients feel as palpitations. Beyond palpitations, people with POTS often describe fatigue, lightheadedness, shortness of breath, and a kind of mental fog that makes it hard to concentrate. It's more common than most people realize, and it disproportionately affects younger women. The problem is frequently missed or dismissed for years before someone connects the dots. In most cases, the heart muscle itself is perfectly healthy in POTS. The issue is how the body regulates blood flow and heart rate when you change positions. Palpitations are common. They're your body's way of telling you that something is worth paying attention to. Whether it's something as simple as an extra cup of coffee, or something like POTS, or an undiagnosed serious heart condition, palpitations should be evaluated by your doctor or a cardiologist. If this is something you're experiencing, don't ignore it. Thank you for watching, and if you found this video helpful, please like and subscribe for more videos like this. This video is for educational purposes only and is not medical advice.